Hello everyone. When a patient with hernia is advised surgery, one of the common things which they ask us is, sir, should I go for the surgery immediately or do I have some time? If I have some time, how much time do I have? Or how long can I postpone this operation? So why do patients want to postpone a surgery? The reasons can be many. One can be social, like they might have commitments in the office, they have to arrange for leave. There are times where the patient is living abroad or wants to travel to his home country for the treatment. The cost can be financial, where sometimes patient needs to put together the money required for the surgery. There can be some other family functions which they would want to finish before getting the surgery done. There can be medical reasons where the patient might be having a more serious medical condition which needs attention first before we go to the hernia operation. So there are so many reasons why a patient would want the surgery to be postponed. Sometimes even the patient is not psychologically prepared to undergo a surgery and needs some more time to gain some confidence when he or she can undergo an operation. So how do we decide which hernias need surgery immediately and which hernias can be safely deferred or postponed? And if so, how long can you postpone it? One thumb rule about hernia is any hernia which is painful, which has brought the patient in an emergency condition to the hospital. The hernia has got stuck, it is not going back inside and the patient is having severe pain over the hernia, needs the surgery right away. There is no doubt about this. There is no question of postponing such a hernia because it has already become complicated. On the other hand, hernias which are not an emergency, in an emergency situation, what are the characters which we see to decide that this can be safely postponed? We can safely postpone a small belly button hernia. Generally, if a patient is having a good muscle tone and he has a very small belly button hernia which is not causing much symptoms and it has been found during a routine checkup, we can postpone the repair of this hernia for a future date safely. Second, the patient should not have any severe cough or any severe straining like difficulty in passing urine or constipation when he has a hernia, because in such patients the chance of a hernia getting stuck outside when the patient coughs vigorously is high. So we generally try to avoid postponing this operation for a longer time and advise the patient to get a surgery done much earlier. Hernias should be easily reducible. Like if the hernia is not going back freely, the patient says no, every around 1-2 weeks the hernia gets stuck outside, it doesn't go back in and then it goes back in after 1 or 2 days. These hernias we generally avoid postponing, we go for an early operation. And people who have a hernia who are in the job or in the habit of heavy work, like heavy weight lifting in the gym or in heavy weight lifting at their jobs, we do not advise them to postpone the hernia. We would rather advise them to get a hernia repaired immediately and then resume their job of heavy weight lifting after 3 to 4 months. Then patients who have prostate problems, there we would advise them to fix the prostate problem as early as possible before going for hernia repair. So these are the scenarios where we take into consideration all these factors before advising the patient if they can postpone their hernia surgery safe or not. There is no safe period where we can say you will be safe till 3 months and after that there is a risk. That is very difficult to say. It's an interplay of so many factors. But by and large we can decide which hernias should be operated immediately and which hernias can be postponed to a reasonable time. It is generally advised for all hernias to be repaired surgically because hernias do not become well by themselves. No hernia will disappear and cure by itself. No medicine will make the hole seal itself and make the hernia disappear. So all hernias invariably need an operation. When and how quickly will depend upon all the factors we discussed now.